Sarah. I'm going to be doing your respiratory assessment today. First of all, are you having any respiratory issues, any past respiratory problems?
No, I'm good.
All right, that's great. So first I'm going to start off and I'm just going to take a quick inspection and assessment, of your skin. Make sure that there's no cyanosis or a bluish color. So we just look at your lips. If you could open your mouth, we look at the inside of that. It's nice and pink. We look at your nail beds to make sure you're getting plenty of oxygen, and that looks great. I am going to take a look at your trachea here just to make sure it is midline. We're going to feel on both sides, and then we're also going to come down to your supraclavicular notch here and make sure that everything is even. And then I can see while you're breathing that your it's bilateral on both sides, it's unlabored, it's regular. You're not having any difficulties, no accessory muscles are using, you're not having any retractions. And then what I'm going to do is, we call this percussion. So I'm gonna start and I'm just gonna take my finger and I'm just gonna tap on my other finger and it's gonna make different sounds as we go down through your lung fields. Is that okay?
Yes.
All right. Sorry, it's in a little difficult spot.
You're okay.
Perfect, it sounds good. Resonates bilaterally, and that's exactly what it's supposed to do. I'm gonna take a listen to your lungs.
Okay.
You can just breathe normally. Okay, so I did take a listen to your lungs. Everything is clear bilaterally, no wheezing. I also did count your respirations. So they're about 17 per minute, and that's perfectly normal. So if you don't mind, I'm gonna have you turn around and then we're gonna repeat some things on the back.
Sounds good.
Okay, so first of all, what I'm gonna do is we're gonna check and make sure that your chest expands equally. So I'm going to put my hands right here and then just have you take a big deep breath. Perfect. Expands just perfect. So expansion is symmetric bilaterally. Next I'm going to check what we call tactile fremitus. I'm just going to put my hands right here. We're going to check the vibrations. So whenever you feel me place my hands, if you could just repeat 99.
99.
Perfect.
99. 99.
Perfect.
99. 99.
Perfect.
99.
All right, so tactile fremitus is present and bilateral on both sides. One other thing that I'm going to do is I'm going to check sort of where your diaphragm placement is. So this is called the diaphragmatic excursion. So first I'm going to have you, you're going to feel me tap it on you, but I'm going to have you take a big deep breath and hold it whenever you're ready. Perfect, perfect. You can let it out. Just sort of going to mark on your shirt where that was and take some normal breaths, and then when you're ready, we're going to blow all your air out, and I'm going to repeat that. Perfect. I'm going to mark that one. Now, since your diaphragm runs all the way across, we're going to have to check that on the other side as well. So when you're ready, I'm going to have you take a big deep breath and hold it. Perfect, perfect. Let that out. And then again, whenever you're ready, just blow all that out. Perfect. So the measurement, is equal all the way across. It's between 3 and 5 centimeters, which is, that's the normal range, and that's where, we like to see that.
Okay.
So next I'm gonna just do the percussion on your back again, like I did on the front. We're just gonna listen to the way that your lung sound throughout. Okay?
Mhm.
Perfect. Sounds wonderful. It resonates, all throughout. I don't hear, anything that's dull or not supposed to be there.
Yes.
I'm gonna listen to your back just like I did on the front. Perfect. It sounds wonderful. So lungs are clear bilaterally throughout on the front and the back. I also did take a look, and I don't see any deformities, in your back. Everything, is normal, as well as the front. And then on the side, it's a good, ratio as it's supposed to be.
Okay.
So while I didn't, hear any adventitious breath sounds and everything was clear, if we would hear some rhonchi or crackles, we could actually do what it's called a post-tussive auscultation, which means I would just listen to the area that sounded abnormal. I would have you to take a big deep cough. If you did have rhonchi, that cough would be able to clear it.
Mhm.
If not, you would hear crackles.
Okay.
And then if that didn't clear and we did hear those crackles, we could do a couple of other tests. The bronchophony, that is where we're gonna listen to the abnormal sound, the area where it sounds. We're gonna have you to repeat Scooby-Doo or 99. If it is, if it is muffled, that is normal.
Okay.
If you can actually hear the sound really well, that's abnormal.
Okay.
Another test that we could do is the egophony. We would actually just have you to repeat the letter E several times. We actually want to hear the E.
Okay.
Abnormal would be if it muffled it and made it sound like an A.
Okay.
And then the whisper pectoriloquy.
That's a mouthful.
That is. I would actually listen and have you to whisper, 1, 2, 3.
Okay.
So normal is the whisper, you really can't tell what you're saying, and
Okay.
then the abnormal would be you could hear it really well.
Okay.
But other than that, your respiratory is wonderful, clear bilaterally, no cyanosis, perfect chest expansion,
Awesome.
And all that good stuff.
A good Queenville help.
Yes, wonderful.
Thank
Thank you so
you.
much.